Center for Women's Health Research at the University of Colorado's Anschutz Medical Campus is engaged in a research enterprise model which is cross-collaborative and integrative. We are looking to be a model for the country in women's health research. The three-part mission of the center is first to do groundbreaking research in cardiovascular disease and diabetes, second to mentor and train the next generation of researchers in women's health, and third to educate the public and their healthcare providers. The Center for Women's Health Research is currently supporting 18 young scientists and physician scientists. We are really excited about their progress, and today we're going to show you what just 3 of them are doing.
I received a Birch grant with the support of the Center for Women's Health Research in order to study fetal and neonatal growth, and more specifically, to study the problem of intrauterine growth restriction. This grant has been really incredible for my career because it's given me the support in order to spend the majority of my time in the laboratory answering questions that come up in the neonatal intensive care unit about growth and wellness of babies. When babies are born with low birth weight, they are at increased risk for developing type 2 diabetes, heart disease, and obesity later in life. I feel incredibly supported by the center, not only in terms of my scientific career, but also because of the broad community support that the center provides. If and when my laboratory is able to make a groundbreaking discovery in fetal and neonatal nutrition, the center will be able to disseminate this information to the community and really provide an avenue for spreading information that we discover in our research careers.
When I really started to delve into the topic, it really struck me how understudied cardiovascular disease was in women and how little we actually knew about the differences between men and women in the development of cardiovascular disease. So there are 2 things we're working on. One is understanding differences in blood vessel health, and the other is understanding differences between men and women in the way heart muscle cells respond to various stressors like high blood pressure or valve problems. We found that the blood vessels from women appear to be more resistant to the development of disease that might predispose them to heart attacks and strokes. Interesting thing about that is it looks as though when women develop heart attacks or strokes, they actually do worse, and so there's some incongruency between those 2 data sets. Our ultimate goal is to improve outcomes in women following cardiovascular events, and if we can understand what the process is that connects blood vessel health and these disease outcomes, we can potentially find particular therapies that might be more useful in women than men. And one of the interesting things that we found is that the proteins that connect the cells and allow them to communicate with one another respond differently to various stressors between men and women. And we think that this is important because these communications are what keeps the heart contracting in a uniform fashion and prevents people from having abnormal heart rhythms and sudden cardiac death. To get a big grant from, say, the National Institutes of Health, you need to already have generated some data. The small grants that occur through the center are critical for especially junior people to generate that small amount of data. The development of the center really provides the critical core of experimental, scientific, and clinical personnel to really advance the field.
The grant that I got from the Center for Women's Health Research was instrumental in allowing me to get started in research at a time when others were giving up because it was so hard to get funding. We're trying to look at the effect of diabetes on the ability to exercise and the heart and blood vessel in teenagers. And what we're finding so far is that despite their young age, that children even as young as 12 or 13 years old who have type 2 diabetes have decreased ability to exercise and have evidence that their heart is thickened and not working as well as it should be, and problems with the blood flow in their blood vessels. We bring the children to the Children's Hospital or different places within the university hospital to do several tests. One of them is an exercise test where they ride the bicycle so we can understand more about their fitness level. And we do another test looking at the heart and the blood vessels with ultrasound. And we're also using an MRI to try to look at the muscle and understand more about the way that the muscle works during exercise in people with type 2 diabetes. And finally, we admit the children to the hospital so that we can look more at the way insulin works in their body. And this allows us to understand more about how insulin works in adolescents that have diabetes and how we might better treat them in the future. And we're hoping to identify something like an exercise or a medication or a diet intervention that we could then provide to these youth to try to help prevent heart disease from happening early in them. Results that we got from the study then allowed me to apply for other grants, and I now have independent funding to try to continue this research. But without that initial boost and start from the Women's Health Center, I wouldn't have been able to get started in research, and so it was really at a pivotal time in my career.
There's a huge gap in what we know about cardiovascular disease and diabetes in women. The center wants to close that gap through its groundbreaking research, through mentoring and training the next generation of scientists and physician scientists, and through educating the public and healthcare providers. The Center for Women's Health Research is a unique model, and what really makes it special is the support of the community. With your support, we can close the knowledge gap and become a national model for research in women's health.